Right. Can we elect an African American to be President of the United States?
Yes, we can. Yes, we did.
Can we elect a community organizer to be President of the United States?
Yes, we can. Yes, we did.
I'm Dr. Bill Honigman, and I'm a proud community organizer with the group Progressive Democrats of America. We represent the Democratic wing of the Democratic Party and are proud to stand for a single-payer Medicare for all system of healthcare reform as a matter of social and economic justice for California and for America. As a full-time emergency room physician for almost 30 years, I have seen firsthand those who have fallen through the cracks, those who have let their health go due to lack of funds. And I've seen the incredible waste of misdirected resources brought on by the health insurance and pharmaceutical companies that have bankrupted our entire country every bit as much as the illegal and immoral wars these same people in power have perpetrated the last several decades of our lives. A true PDA hero in Congress, Representative Barbara Lee of Oakland, has coined a phrase worth repeating in discussing the issue of our current financial woes. She calls it the Iraq recession. The Iraq recession. Well, at PDA, we say, give us health care, not warfare. Health care, not warfare.
Health care, not warfare. Health care, not warfare.
That's right. PDA California holds Governor Schwarzenegger responsible for failing to enact legislation that Senator Sheila Kuehl brought twice to his desk. That would have brought economic and social justice to our state in the form of single-payer health care for all, and will hold Schwarzenegger and his party of no accountable yet again if they block it when Senator Mark Leno's SB 810 is passed. And mark my words, it will be passed again and again if needs be. Right, everyone here? We're all going to make sure it passes. We all know there's a cancer in America's economy. It's called health insurance and for-profit funding of health care, and it needs to be cut out now. I brought a prop. Okay?
Benjamin.
Nice. Benjamin. With a full third of every healthcare dollar wasted on administrative, CEO, and big pharma profits, America options will only delay the inevitable and cause any benefits brought about by reform to be lost. We need single-payer Medicare for all to have a seat at the table now for any meaningful discussion of healthcare reform to take place. As Dr. Martin Luther King said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Thank you all for being a part of our movement and for all the work you are doing.
Thank you, Dr. Bill.
Thank you, Dr. Bill.
All right, we have a slightly more famous doctor next. There's a very exciting new project that we were announcing today. There are a series of public service announcements that have been made, and they're shown in the booth down there on the white. They feature our next speaker, and you can go watch that short spot and send a fax to the White House today. So after the rally, please be sure to do that. It is now my pleasure to introduce a longtime activist for social and economic justice, a proud supporter of single-payer health care. You know him as B.J. Honeycutt from MASH, Mike Farrell.
Thank you and hello and good morning. I'm pleased to be here with you, and I'm sorry that you're out here and they're in there. You know, it's sort of a joke to say I played a doctor on television, so I know something about health care. So I don't claim to know something about health care. I am an advocate for human rights. But I understand that health care in this country is and ought to be a human right. As we understand it in this country, there are certain fundamental things that belong to the people. This healthcare is one of them. We should get the profit motive out of the healthcare system, and we do that by establishing something that seems to be unspoken inside, and that is single payer. I don't understand, I must say, I don't understand why the debate is being cut off. I don't understand why Dr. J had his piece at the Iowa conference eliminated from the videotape. I don't understand why it is so impossible for people to accept the fact that all of us deserve to have a healthcare system that works for all of us. And Medicare for All, for example, everybody in and nobody out is something that makes sense to me. So I appreciate your being here. And I appreciate the presence here of Lieutenant Governor John Garamendi and all of the doctors and healthcare professionals whose concern is about the people and not about the profits that are being made by insurance companies that don't care if everybody gets health care. So thank you for being here.
Thank you, Mike Farrell.
Thanks, Mike.
All right, our next speaker.
Go ahead.
He's AFT Vice President for the United Teachers of Los Angeles. He's going inside after this. Josh Peschel.
Thank you very much. What an honor to speak after Mike Farrell. In the education world, healthcare has become a crisis, just like it's been a crisis throughout the economy. In Los Angeles, the cost of healthcare for district employees alone is soon to approach $1 billion. $1 billion. If we had a single-payer system, we would save anywhere from $200 to $300 million right away. That's money that could go to reducing class size by 10 students per class. That money could go to saving district employees who now face layoffs. That's money that could go to provide resources, computers, make sure that our students have the very best to succeed in this society. But right now it's being gobbled up by insurance companies that are more concerned about profits than about the health of the people that they insure. And that's not right.
Actually, you can see
we need to stand strong in this fight. We may not win this in the short run, although if we continue to put crowds like this out across the country, we may win it in the short run. But I think we have to prepare ourselves for a long battle on this. Because even if the Obama administration comes up with something that's not what we want, we know it's not going to succeed, just like the health care plan in Massachusetts is not succeeding. And that's when our plan for comprehensive health care reform that removes the insurance companies, that truly provides quality health care, is going to be understood as the only solution for the health care crisis. We need to stand strong. We need to continue to argue with our friends and family why removing health care companies is the only solution for the health care situation in this country. Thank you very much.
Thank you, Josh.
All right, go.